All this is Dr. Mobeen Sayed from drbeen.com. Hopefully, you're doing good and having a great weekend. Today, I have a very exciting study to share with you. It is from my country of origin, it is from Pakistan, but the study itself has a beautiful data in it, which I think is super exciting. The reason it is super exciting is that the substance that we're going to talk about, it contains zinc, vitamin C, quercetin, and then other substances including other vitamins as well. And it has shown to be more effective than hydroxychloroquine and remdesivir and even dexamethasone. And we would look at the data together. So I think, and on top of this, it is a cheap over-the-counter thing as well. I actually have it with me right here. This is the substance is called, or this seeds are called Sativa Nigella, or whatever is the right, Nigella Sativa, whatever is the right pronunciation. And if you see here, I have it with me here. If you can see them, these are the seeds. We use them, number one, to eat. Normally what we do is that in the morning, we take a pinch of these and we eat them. Then in addition to this, these seeds are used in cooking as well. So sometimes meat or other things, pickles, for example, they have these seeds as well. These are very commonly used seeds in Arabian cultures and in Asian cultures. And the data is exciting. Some of the folks here, Cool Beans here, had been asking me to talk about this for, I think, a couple of months now. And I had been avoiding it because I wanted to first look at the mechanism of action and understand it before I talked about it. So I have the mechanism of action down and I understand what is the mechanism, and then I understand how it works. So let us start our discussion. Hopefully you're all doing great. And this is something that if you can buy over the counter, and it is available here in the US as well. Of course, I'm here in the US and I have it here. This is a beautiful prophylactic plus management substance. I keep calling it substance. It is these are seeds. So let's start. And welcome everyone. I love to see you here. Thank you very much for being part of this journey. We are, I think, including the question answer videos, we are about 230 videos now. Okay, so this is drbeen.com. We have our Cyber Month sale going on. So if you go to check these plans, you can see very, very discounted prices. So with this, here is the preprint of the study. This is a study which contains honey, Nigella Sativa, and that combination given to patients versus placebo. It's a double-blind, randomized, controlled study. So we're going to look at it, and it is a preprint. So let's just look at the other links that I have here. This is the study on the clinical trials. And if you see here, this is the dosage that they used. Honey, 1 gram per kilogram per day. And Nigella Sativa, or whatever is we call it Kalwanji, or black cumin, 80 milligram per kilogram per day. That is the medicine that they used. Beautiful results. I was actually surprised to see those results. Then here is a very decent article about the components of the Nigella Sativa, or these seeds. So what is part of what are the things in it, and the mechanism of action of various components in this. So this is a good study. Then I have the main active ingredient in Nigella Sativa, which is Thymoquinone. That is here. And then finally, it has it is part of Quinine as well. So hydroxychloroquine and the others, they have a tiny part of this Nigella Sativa's active molecule Thymoquinone in it as well. So they are different things, but still there is one ring in the hydroxychloroquine and chloroquine that comes from Nigella Sativa, the Thymoquinone part. So with this, let's look at this study. I think you would like it. So let's start. And here is the preprint PDF. I'll go over something. Actually, let me show you one thing that really caught my attention, and then we'll go to the illustrations. Sorry, just 1 second. Check this out. This is, I think, the most important part. So once again, it is an inexpensive seed called black seed, and it is over the counter, available everywhere almost in the world. And look at the mortality reduction when used for COVID-19. Check this out. Mortality among severe cases. So I have gone way ahead at the end of the study, and I'm talking about mortality. But I want to put that case in front of you first before we talk about everything else. Mortality among severe cases in comparison to control group. Now check this out. 27% versus 25% for hydroxychloroquine. So they were giving to some patients hydroxychloroquine, I believe with zinc, and the difference they saw was 27 versus 25%. So I think they didn't see a lot of difference. And again, this is severe cases. So you know that in severe cases, usually hydroxychloroquine is too late to use at that time. So it's not hydroxychloroquine's fault that the data is such. It is just used in a severe case. Then 19.2% versus 25% for lopinavir and ritonavir. So slight improvement if you are using antivirals. Again, severe cases may not actually be responding to antivirals because they are in immune dysregulation. So I do not know since when did they start giving them antiviral. Did they start it when they were on the shortness of breath, and when they had the shortness of breath and they got admitted, then it is a fair comparison. Then look at this, 15.7% versus 24%. So 15.7% who received the convalescent plasma and 24% who did not receive the plasma, the mortality rate. 11.4% versus 15% for remdesivir. So those severe cases or those patients who were receiving remdesivir, 11.4% died in their study, and 15.2% died in placebo group. Dexamethasone, 22.9% versus 25.7%. And check this out, for honey and Nigella Sativa combination, the mortality rate was 4% versus in the control group, 18.87%. 4 times reduction in mortality. I remember my mother, so my mother used to feed us, give us this kalwanji every day. And she used to say that it is said that these seeds have a cure for everything except death. So these used to be given for almost every kind of disease. But I was impressed by the mortality reduction numbers here. Now let's look at it from my illustrations. First of all, honey and the combination in this study that they used was, let me just take the layer panel off. So what they did was they used honey and they used Nigella Sativa. These were the two things that were given in combination. We saw the dose before. Now, interestingly, in silico studies, that means on the computer, and in vitro studies, that means outside the body in the petri dishes, or in the lab, both of these substances have been observed to reduce the SARS-CoV-2. So the question is, we're going to look at it, that how does that work? So in the Nigella Sativa, the main important ingredient is thymoquinone. In addition to that, it has nigelladine. So here, if you see nigelladine, alpha-hedrin, zinc, quercetin. Because it is a seed, it has flavonoids in it, which contains quercetin. So zinc and quercetin together in it, and vitamin C, other than many other vitamins and other substances. So check this out. This is like somebody created the whole recipe for prophylaxis and put that in one place. Thymoquinone, that is I hesitate to say it's similar to hydroxychloroquine, because hydroxychloroquine is a bigger molecule, has more things in it. But one active part of hydroxychloroquine, or quinine, is this ring, thymoquinone ring. So thymoquinone here, then zinc and quercetin here. So imagine if you have hydroxychloroquine, zinc, and quercetin all packaged in one area. So that is a kind of thing here. But once again, please realize that hydroxychloroquine and quinine is different from thymoquinine. They are not the same thing, or thymoquinone. So these are the active substances. And look what they do. The studies that have used them, what is the effect they have seen, especially for respiratory conditions. They have seen that when you use Nigella Sativa and honey, pulmonary functions tests improve. So pulmonary functions improve, number one. Number two, respiratory symptoms improve in patients. Cancer cell viability is reduced, meaning cancer cells die more easily. They proliferate less, they die more, they apoptose more. I remember my mother's sister, my aunt, had breast cancer. She used to be in UK. We were young. She eventually died of it. And I remember we used to pack these Nigella Sativa and send it to her. So she did not make it. But anyways, in those cultures, these seeds have a lot of function. So now let's look at the study. The study was interesting. They did this study from April 30th to July 29th. The link that I showed you is a preprint. It's a I won't say small, it is not lesser than 100. If you see, 210 people in moderate patient group and 103 people in severe patient group, so decent size. Significant results. It's a multi-center, placebo-controlled, randomized study. What they did was they had given 1-to-1 distribution. So some people, half of the population got the honey and Nigella Sativa, other half got placebo. And the objectives were, they were trying to see if the symptoms will be reduced or alleviated early, that is one. If the virus would clear early, that is two. And if the 30-day mortality will be reduced. So these were the three things that they were observing. I think when you'll see the results, you'll be impressed, and I am impressed. And I really think that this is another interesting thing that at least we should use for prophylaxis. So what they did was, in the moderate group, they had 107 people on honey and Nigella Sativa, and 103 were on placebo. In the severe group, out of the 103 people, they had 50 people on honey and Nigella Sativa, and 53 were on placebo. That was the division. Now look at the results. Look at the results. Alleviating the symptoms. Honey and Nigella Sativa, within 4 days, the symptoms were alleviated. Placebo, 7 days. This is the moderate. So the first line is the moderate, the second line is severe. So in the moderate, hazard ratio was 6.11, 95% confidence interval is 4.23 to 8.84, which means it is on one side of the unity, which is excellent. And p-value, look at this, 0.0001. So the chance for randomly this data to appear with placebo is 1 in 10,000. So it's a very decent p-value. In the severe cases, the symptoms were alleviated on average by 6th day, compared to other patients who were not getting it, placebo group, 13th day. And look at the hazard ratio, 4.04, 2.46 to 6.64. Again, on one side of unity and quite pushed from it, which means it is good. And the p-value, once again, is very good. Viral clearance in moderates within 6 days compared to placebo, 10 days. And if you look at it, this all is significant as well. In severe patients, 8.5 days versus 12 days. And again, p value and confidence intervals are significant. Clinical score on the day 6. How have the patient been improving? What is their situation? So in moderate cases, on 6th day after receiving this combination, patients resumed their daily activities. So 63.6% patients who were receiving this combination resumed daily activities, while 10.9% patients who were receiving placebo were able to resume their daily activity. This is huge. And again, the data is significant. Hospital discharge in severe cases. Check this out. 50% on honey and Nigella Sativa. 2.8% on placebo. This huge difference. And again, data is significant. Odds ratio 0.03. Beautiful, beautiful data. Mortality. Honey and Nigella Sativa patients, 4% mortality. And this is severe. So we're not talking about all patients. On average, out of 100 all patients, that includes asymptomatic, symptomatic, mildly symptomatic, moderately, and then severe. Out of all of them, 4%. And we know that out of severe, at least 30 to 50% of the patients die. Here, check this out, mortality in HNS, 4%. And in the placebo group, which were receiving other things, 18.87, and odds ratio 0.18, so about 82% improvement, and 95% confidence interval is significant. The p-value is significant as well. And there were no side effects observed for this. I was actually blown away when I looked at this data. I loved it. And these things, these seeds, once again, I might be looking like I'm selling these. I don't sell them. But it is just interesting. These seeds are available for cheap everywhere. So now I'm going to go over some of the salient points of this study as well. Did I mention how it actually functions? Where did that slide go? So one second. Yeah. So I want to show you how does it act? What is the action in it? So check this out. I missed this part. Nigella sativa and honey have an antiviral effect. And what happens is both of these components have high affinity for SARS-CoV-2 enzymes. So when the SARS-CoV-2 arrives in our cell and is making its own proteins and enzymes to build its own new daughter SARS-CoV-2s, these substances bind to its enzymes and disrupt them. So that is the antiviral effect. Then antioxidant, of course, there is vitamin C and other substances that act as a radical scavengers. So it is antioxidant as well. Then anti-inflammatory. Nigella sativa is known to suppress the cyclooxygenase and lipoxygenase pathways of inflammation. And then finally, immune modulator. It can modulate and balance out interleukin 1, 6, 10, 18, 8, tumor necrosis factors, nuclear factor kappa B, which we talked about it yesterday as well, and then so day before yesterday, and interferon production modulation. So all immune system mechanisms are modulated, inflammatory mechanisms are modulated, antioxidation is done, antiviral properties are done. So beautiful thing. And I want to now, this is the last part. Let me go over some of the things here. So, so here is the study. They've done a good job. I would recommend, if you can download the study, the mechanisms they have explained very well. But I want to just go over some of the things. So look at this. This is honey. In silico molecular docking studies have shown that 6 flavonoid compounds from honey might inhibit severe acute respiratory syndrome, coronavirus 2. So that is one thing. Then if you see, there is more that they've discussed: T cell, B cell modulations. Most of these things we know. Now, on the Nigella sativa, it also has shown to decrease the replication of SARS-CoV-2 in vitro in cell cultures. Molecular docking studies have shown that some of its components, such as nigelladine, alpha-hedrin, and thymoquinone, have high affinity with several SARS-CoV-2 enzymes and proteins. So it binds with them and disrupts them. In fact, check this out. They exhibit an energy complex score better than that of chloroquine and hydroxychloroquine. So imagine in this little seed, in this thing here, it has thymoquinone plus zinc plus quercetin, all three packaged together. And so it shows a better energy score to disrupt or to help with the zinc and then disrupt the virus. So that is beautiful. It also demodulates the secretion of number of pro-inflammatory mediators and improves helper T cell, CD8 T cells, which are cytotoxic T cell ratio, and increases natural killer cells. Remember from the beginning of the discussions, I've been saying we need to find ways to improve our natural killer cells. And in that, we talk about yoga, we talk about forest breathing, forest bathing, we talk about relaxing, better sleep. So here you have one more thing in your arsenal that you can actually use Nigella sativa with honey combination as well. So again, please realize that honey is sweet. And so folks who are diabetic, they should be careful and talk with your doctor or check your diabetes sugar levels when using it. Then some more things here that I have highlighted, not a lot, but some things that I wanted to show you. They have captured good data as well. And so then they say all data combined is suggestive of robust therapeutic profile of honey Nigella sativa, and results can be highly encouraging amidst current second wave of SARS-CoV-2 infection. So this is the discussion for today. Discussion is done by, so when I read this paper, it reminded me of my own time. I studied from King Edward Medical College, which was Pakistan's best medical college when I was doing. Now there are Aga Khan College, which is supposed to be great, but I think King Edward is awesome. And with that, Mayo Hospital. And on the other hand, there was Illama Iqbal Medical College with Services Hospital, and then they have their own hospital as well. And so we always used to kind of have a competition. So this study is coming from Sheikh Zayed Hospital and Services Medical Center. So Services is a good hospital as well. So I love the study that came out, and I love what is presented in here. So that is the discussion for today. I'm going to just look at a few comments here, and then we will go. So this is called Kalonji, Klonji, Kalonji, or this is called black seed, or black cumin, or Nigella sativa. So Zunar says some question, oil versus seed. So I have been using seed. They had used crushed powder of Nigella sativa. Jem, you're very welcome. Question from BLSR. The study said it used the seeds. How much of the oil could be used instead of the seeds? So at the end of the day, they used powder, 80 milligram per kilogram per day. So an equivalent, if you can find in the oil. Misty, yes. In many of our foods, we actually have these seeds added to the food for cooking. So I have demonstrated eating them. They're kind of tasteless. It's fun to eat them. Raw honey, yes. So they had honey, raw honey with these seeds combination. So Shahida says Kalwanji 1 gram per kilogram. What about dosage of honey? So let me very quickly show you the dosage once again. I'm going to share my screen. So in there, clinical trial site, and I have the link in the description. If you see here, check this out. Honey 1 gram per kilogram per day, and Nigella sativa 80 milligram per kilogram per day. And they said that we used crushed powder of Nigella sativa. So see here, drug Nigella sativa seed powder 80 milligram per kilogram per day, grinded in capsule up to a max of 14 days. And then natural honey 1 gram per kilogram per day, orally up to a max of 14 days. So that is what they had done. What else? Golmuk says, did you cover the two studies, Dr. Bean? The other RCT is pretty good too. I did not find it. Can you share the link with me? I found this one and this looked good as well. So for his glory ministry says, I have a hard time with taking the black seed oil because it lowers my already low blood pressure. Would the powder form be less lowering of the blood pressure? You'll have to try it. So try a smaller quantity. For example, I know some of my doctor friends who only take 7 seeds every day, just 7 seeds. So try it with a smaller dose and see what happens. Runaway train, very good question. Aren't all the viruses dead anyways? Yeah, so the for us to say killing a virus, the right term should be inactivating or making it less viable. That is the right term, but in general we just call it killing the virus. So yes, they are dead. They just have the RNA in them that just knows how to make more copies of them and just spread that way. Other than that, they have no other life-like behavior. Some people, so there is philosophical discussions that, well, spreading itself is a life's behavior, so because of that they are alive. So I don't get into that discussion. Take your pick. At this time, what is important is that how do we get rid of this thing? M. Gregory, don't eat the soap. No, it is not onion seed. These are a separate plant. So the link, Le Prince, is in the description. Black chia seeds are great as well, but they're different from these black seeds. So any other question here? Sheikh Maniac, very impressive mortality rate was this. A phase 3 study saw that the remdesivir and the, so I don't think that they were doing a, let's see what is their, if they declare a phase. Interventional 330% randomized parallel triple care treatment. So official title, I don't think that they were actually using this as a new drug to do phase 1, 2 or 3. Good question. So Kathleen says, so the seed and honey have quercetin, vitamin C and zinc in large amounts. I think the amounts that they used was decent enough to create the results. What is the right exact amount in them? I'll have to look it up. Yes, Janet, yeah, don't eat the soap which has seeds in them. Edog says, is Manuka honey better? Edog, I frankly do not know the honey's types. So I'll have to research that. Sepal, can you get Nigella Sativa as a supplement? I'm sure, but this is very commonly available in the US as well. Wayne, that is a very good thing. I would send it to him. When I started talking with Dr. Marek, he used to say that people just inundate me with so many studies all the time. I find it hard. So I usually spare him from that, but I can share it with him. Can you please show the image? Vasant, which image? From your name, I cannot pronounce your name, I cannot read, but I think these will be available from Asian and Arabic stores in your area as well. For his glory, Dr. Bean, I just want to congratulate you for all your fantastic work and honestly bringing the truth to all of us. God shall surely bless you. Christ, many blessings to you and family. Thank you very much. I am honestly, I feel that I'm blessed that I have the opportunity to present this. So thank you for listening to these talks, and thank you for being with me, and thank you for working to protect ourselves and our loved ones and humanity in general. So thank you very much for being with me during this time. Cool. Yes. So Rajesh, this is a very common saying in our area of in our countries, that the prophet had said that these seeds have cure for all diseases except death. Cool. So there is one more question here. Jamie says, would you replace any of our supplements with these seeds? Honey, I would actually add them instead of replacing some of these. The only thing is quercetin is present in these seeds as well, and quercetin is separately taken as a supplement too, but I would not replace them. I would just add these on as well. So I think that is the discussion. Do you know what is tomorrow? Tomorrow is my day off. I'm going to miss you guys, but I'll take a day off tomorrow. I had a day off yesterday or day before yesterday as well. So I think yesterday was the day off too. So I have 2 days off in this week. All right. So I will see you all on Monday. Please stay safe, happy, and healthy. Stay relaxed. Take a good sleep. Drink plenty of water, mouthwash, gargles. These are good things. Some exercise. And I would see you on Monday. Thank you very much. Please like, subscribe, and share. And if you wanted to support my work, there is a link in the description for donations. Thank you. Bye-bye.